Hi, welcome back to my channel. Today I've prepared something great for you. Like I promised, there always be something about mental health, and today I want us to learn about mental health. Today I have a guest. He's a psychiatric nurse.
Sure.
And he deals with mental cases. Today we are going to deal with depression. Kindly introduce yourself.
Thank you. I'm Nicholas Onjiro, and I'm a psychiatric nurse. And from the introduction, I heard you saying that you will be dealing with depression.
So what is depression?
Depression, by definition, is a mental disorder or mental illness characterized by a low mood or depressive mood. And it's one of the serious mental illnesses that we have. Yeah.
How can you know that someone is suffering from depression? What are the signs and symptoms?
Well, signs and symptoms, by definition, symptoms are indicators that leads us to a conclusion that this particular person has this particular illness and not that other one. As opposed to sign. Sign is what you can see. For example, one way I can tell that you have a wound is by seeing it.
Okay.
Now, by seeing it, that's a sign. But the way I can tell that you're hypertensive is through taking your BP. The readings are the ones that will tell me there's something wrong with your blood pressure. Those are symptoms. So in a layman's language, symptoms are indicators and signs are the things that we can see. Now, coming back to the signs and symptoms of depression, there are several. And one of it is low mood. You're always in low mood. It's like you're sad, always sad, but you cannot be able to explain your sadness. Get that? Then you're lonely. You always feel you're lonely.
Okay.
Yeah. In as much as you have many people surrounding you, many people talking to you, many people listening to you, you always feel lonely. You get that?
Yes.
And then we have loss of interest. Like you're not interested in anything. Let's say, for example, you used to like music, playing football, whatever you used to do, your line of duty, you're not interested anymore. And that is accompanied, it goes hand in hand with what we call a motivation. Lack of motivation. You don't have motivation, you don't feel motivated to do anything. So those are the people you find. They wake up, take their breakfast, and then get back to bed. They sleep at night and at day long. Or sometimes they even don't wake up to take their breakfast. They just spend all their day in the bed. You get that? Then we have some people with depression get what we call insomnia, lack of sleep. They don't sleep. Or some other people, they get what we call hypersomnia. They sleep a lot.
Okay.
They just sleeping.
I did not know.
Yeah.
I'm Sonia.
Yeah.
It is?
Yeah,
Hi.
yeah, so we have those people who sleep a lot, and we
There are
have
those who
people
don't
who don't sleep. Yeah.
Okay.
And then we also have lack of appetite. People who are depressive don't eat. Some of them don't eat at all. Yeah, they don't eat at all. So they lack what we call energy. They don't get energy. So that's why you find them doing nothing, because they don't have energy. And also, to the other end, we have people who eat a lot. They are depressed, so they eat a lot. So you can have people who are eating less, and you can have people who are eating more.
Are those conclusive signs and symptoms, or there are many? Those are just some of them.
Those are just few, but there are. However, there's a cardinal sign of depression, which is suicide. We have suicide ideations, and we have those people who normally commit suicide. Yeah.
Okay.
And this is accompanied by hopelessness. I told you, you just feel loneliness. Yeah, and also there is the guilt. People with depression, they have guilt.
Okay.
And they can't explain their guilt actually. You know, when you do something that you feel, your conscience tells you what you did is not right. That's when your guilt starts haunting you. But now these people with depression, they can't explain their guilt. Yeah, so those are the signs and symptoms.
How does depression affect your general life or your health?
Well, depression, like you've seen, it is accompanied by low mood. And like we said, from the symptoms, basically there are a lot of results that are going to come from the symptoms. And one of them is low productivity in work, social life, wherever you are assigned. There is what we call low productivity, because there is a motivation. Then there is self-neglect. You don't take care of yourself, hygiene-wise, and as a result, sometimes you can also get some diseases. Yeah, if you don't take your personal hygiene seriously, definitely you'll have what you call diseases. You get that. And then there is sleeping difficulties, and if there's sleeping difficulties, you get someone, if you don't sleep well, you'll always be hanging. Let me use that word. You see?
Okay. Yeah. How is depression treated when someone now comes to your facility or goes to a hospital? How do they treat depression?
We have various approaches towards the treatment of depression, but we have two major ones. We have what we call pharmacotherapy, that is the use of medication. We have various medicines that are used to treat depression, and actually that should be the very, very, very fast approach towards the treatment, because if you don't treat the depression, the other approaches, through the help of medicine, the other approaches won't be helpful. So there is what we call pharmacotherapy, and then there is what we call psychotherapy.
Pharmacotherapy,
just like I said, is the use of medicine, but pharmacotherapy is used. I mean, now there is the second one is the psychotherapy.
Psychotherapy, okay.
It's whereby you get to journey with a counseling psychologist or clinical psychologist who will help you understand your condition, know how to live with it, know what to do once the situation aggravates, you see. However, we also have what we call family support. People with depression needs a lot of understanding from the family, and sometimes you see these people don't take food, sometimes they don't take care of their personal hygiene.
So you have to take care of them and keep looking
after them. You need to keep looking after them. And the ones who are suicidal, you need to keep monitoring their actions, their steps and all that, so that you don't get your loved one committing suicide.
So how
and also, before we go to the other question, I'll say the major one is pharmacotherapy, psychotherapy. Pharmacotherapy, use of medicine, psychotherapy, what we call psychological counseling, and then family support, like I've said, and then we have spiritual support. Spiritual support is whereby we have spiritual leaders, like pastors for Christians, sheikhs for Muslims, and all those people coming in to help these people. Yeah, pray for them, pray with them, things like those. Yeah.
So how can you tell that someone is getting worse? Is suicide a sign that depression is getting worse?
Yeah, sure. Suicide is one of the indicator signs that this person is getting worse. However, there is the self-neglect. You find that this person is not eating at all. Someone can go for 2, 3, 4, 5 days without eating. They are not washing their body. You see now a normal person can go for more than a day without washing their body, without eating. So this person is not eating, they are not washing their body, and they are sleeping. And now the cardinal indicator is the suicide attempts. Some people will try to kill themselves through either hanging themselves, swallowing pills, stabbing themselves. And also, by the way, there is what we call self-mutilation is another serious indicator of depression. People who mutilate themselves. By that, they tend to punish themselves. You mutilate yourself. You're blaming yourself for things that you don't know.
You're punishing yourself by cutting yourself.
Yeah. You see yourself bleeding and you're good to go.
So, okay, let's say that someone comes to your hospital and has suicidal thoughts, or is likely to kill himself, or he has tried once.
Yeah.
So what do you do?
Well, for someone who is suicidal, I always say it's very important to get them to a mental health facility, be it a mental health hospital or a rehabilitation center. Because in such a facility, there is what we call suicidal caution card. And that card helps us to monitor someone who is suicidal. And then there are professionals there. Like, for example, you have psychiatric nurses, we have counselors who will keep monitoring this particular person, who will keep journeying with them. And in case of any attempt whatsoever, there is a first aid measures that are taken out there. So, in such a facility, someone who is suicidal will be taken care of. Also, I always like saying, there are people who never take people who are depressed seriously when it comes to suicide. Like now, for example, someone verbalizes suicidal ideations or suicidal attempts, and people just start to dismiss them. Kama umechoka na maisha, enda ujue. They never take them seriously. It's very bad, yeah.
You should always take that serious.
You should. The moment someone starts verbalizing suicidal thoughts, because you only know someone is thinking or contemplating suicide through verbalization. You need to take that seriously. You need to take that seriously.
So there's this.
And also, you should not condemn them. Let's say someone has tried to commit suicide and is saved by good luck. You should not condemn them. Instead of condemning them, try to understand the reason as why they try to commit suicide.
Okay, and there's this notion that if you attempt suicide once, you might attempt again. Is it true?
Not really, not really, not really. That is what I call stereotype. See, because like you said, suicide is one of the symptoms of depression. And if at all this particular person is treated, that tells you if the depression is treated, there is no symptom. So this person will not try to commit suicide. That is one. Secondly, if people listen to this person and knows the reason as why they try to commit suicide, and they help them, like now they say I tried to commit suicide because of 1, 2, 3, and then you handle this 1, 2, 3 accordingly in a very, 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 very good and understanding way, chances are high this particular person will never try to commit suicide again, because the reason was that the reason as why he or she was trying to commit suicide has been tackled. Those reasons has been tackled.
So how can you encourage someone to seek help? Let's say like your family member is suicidal or is depressed, or you have noticed those signs of depression. How can you encourage someone to seek help?
One, I always say, if you feel something is wrong with you, you used to be very productive at work, you're no longer interested with your work, you used to socialize well with your people, loved ones, your family, you now don't talk to them anymore, you withdraw yourself, like you don't want to be with people, you need to ask yourself, why is it that I'm experiencing all this? So in such a situation, you need to seek some help.
How can you encourage, like me, I'm encouraging my family member to seek help? As in, how can I, at least, someone maybe who is stubborn, doesn't want to go to the hospital, how can I encourage that person to seek help?
The Republic of Kenya has a very, 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 very good way of handling such people. Whenever someone has mental illness, we have two ways of getting them to a treatment. We can commit them voluntarily, like people can take themselves to a mental health facility for treatment voluntarily, or the people who is taking care of these people commits these people involuntarily. Like now, for example, if you're my parent, you're my mom, my aunt, my guardian, or my fiancé, my wife, and I'm not willing to take myself for treatment, and you can see there's something seriously wrong with me, you can commit me to the treatment. What you do once you get yourself to a medical facility, there are some forms that have been provided by the government. They are called involuntary admission forms. So you sign one, and then the psychiatrist who is attending this particular patient signs the other one. So through that, it shows that you, as the relatives of this particular person, have committed this person for treatment, in as much as they are not willing, because they are not okay actually. So that's why you take the initiative.
How common is depression in Kenya?
I would say that's quite a challenge. In Kenya, we have many depression cases, and unfortunately, that's why we get people committing suicide every now and then.
So
because
do we as a country take mental health seriously?
No. I wouldn't say we've taken the mental health seriously, and there needs to be more and more. People need to be informed of the same more and more. Like people getting to the villages, reaching out to people. The outreaches to synthesize people more on mental health, the danger signs, see things like those.
So is stress also depression, or what is stress and what is depression?
No. Stress is not a depression. Basically, normal life anyway has stressors, and if at all we are exposed to those stressors, we get stressed. You get that? So stress is not
depression.
Yeah, stress is not depression. In life, actually, for information, you have good stressors and bad stressors. You can be stressed. You can have some stresses that are challenging you to do something productive. For example, you're in work, you've not completed your assignment, and it's stressing you so much. So you need to put up your socks, work on it so that you can be. You get that?
Yes.
So, however, much stress can lead to depression. Much stress.
Okay, like the year 2020, even this year, so many people lost their jobs due to COVID-19. Has COVID-19 contributed to the high rise in depression?
Yeah, to a very high rate. A very high rate, and it's not only depression. COVID-19 has also made people get into alcohol and substance abuse, because as a result of the pandemic, many people lost their job, and that's why they are getting their likely money to feed their family, to pay the rent, bills, all the bills they were getting from the job. And you remember, a lot of people were discontinued from their work as a result of COVID-19. So these people got stressed a lot, and as a result, depression prevailed. You get that? And some people who didn't have the capacity to withhold the challenges in terms of I don't have work, I need money to sustain my family and all that, they learn into alcohol and some other substances just to kind of blindfold themselves from the challenge that they are facing. So I would say COVID-19. Also, there are people who are not used to staying at home with their family, their children and all that, and then you've been discontinued from your work and you're spending 24 hours with your wife and your children, something that you've not been used to. So you get yourself getting a lot of stress, taking a lot of alcohol. Some of them get into depression. For those people who got themselves drunk a lot, alcohol is a depressant. And there's something we call alcohol-induced depression. So this
alcohol-induced depression.
So I would say COVID-19 has affected.
When someone is suffering from depression, can he be productive in his life, like in his work, at home?
Oh yeah, someone can be productive. I always say, just like any other mental illness, it's all about management. Once it's managed through medicine, through therapy, psychotherapy and all that, someone can be very productive. Problem comes when it's not managed. When it's deteriorating, there is what you said, motivation and withdrawal from people and places of work, so you can be productive. At the moment it's treated, you're 100% productive in your line of duty, wherever you are, in whatever you do.
So thank you so much for watching this video. So I've learned a lot also on depression. If you have any question on depression, kindly comment down below. Our guest will going to answer all your questions. And also, if someone in your family has ever suffered from depression, suicide, comment below. And if you need any assistance, get in touch with us. He will assist you where he can. And thank you for watching. Let's get our goodbyes
Thank you for
from
watching and listening to us. I always say your mental health matters. If you're not okay mentally, you're not functional at all. So prioritize your mental health. Avoid things that will interfere with your normal functioning of your mind. Drugs, unnecessary stress, things like those. So take care of your mental health and you'll be good to go. Thank you.
Thank you. Kindly subscribe and let's meet there next time. We are going to also to talk. We are going to continue on this topic of mental health. So kindly subscribe and thank you so much for watching. God bless you. Bye.
Bye.